Hi my dear viewers, this is your Vinay voice. So today we are going to discuss about an important LAQ question from the head and neck. Can any one of you name the structure which is enlarged in the picture given below? Yes, you are right. So this is the enlarged picture of the parotid gland. So this parotid gland is an important long answer question carrying 15 marks in your final examination. So let's start our class. So majorly, the parotid gland, para means around, utic means ear. That means this is the gland present around the ear, and it is the largest of the three pairs of salivary glands. So my dear friends, as you know that we have the three pairs of salivary glands. Those are parotid, submandibular and sublingual. So out of these three pairs of salivary glands, the parotid gland is the largest one, and it is composed of serous alveoli. It is composed of serous alveoli and it is lobulated. That means it contains the lobules. The color is yellowish to brown. The color is yellowish to brown and the weight of the parotid gland is about 25 grams. So this is the introduction part of the parotid gland. Yes. So next, you can observe in the picture there is an enlightened area over here. So this area is known as the retromandibular fossa. I repeat, this area is known as retromandibular fossa, or it can also be called as parotid blade. So this is the area where the parotid gland is situated. Okay. Next. So the location, the parotid gland lies in the pyramidal fossa posterior to the ramus of the mandible called retromandibular fossa and the parotid blade. So this pyramidal fossa, it is posterior to the ramus of the mandible. As you see in the picture, it is the posterior to the ramus of the mandible. This is the retromandibular fossa where the parotid gland is situated. Okay. Next, so we will see about the boundaries of the parotid bed. So mainly this parotid bed contains the four boundaries. Those are anterior, superior, medial and the posterior boundary. This posterior boundary cannot be shown in this figure. So let's see the anterior boundary. So this anterior boundary is formed by the posterior border of ramus of the mandible, and the superior boundary is formed by the external acoustic meatus, and the medial boundary is formed by the styloid process with attached muscles. So I repeat, so these are the anterior, superior, medial boundaries of the parotid bed or retromandibular fossa. Okay, so let's recall the things which I have read. Boundaries of the parotid bed, it is bounded anteriorly by the posterior border of ramus of the mandible, posteriorly by the mastoid process, superiorly by the external acoustic meatus and posterior part of temporomandibular joint, and medially by the styloid process. So these things you should mention in the boundaries of the parotid bed. Next, we will see about the parotid capsule, or it can also be called as parotid sheath. The green color one which is there is known as the parotid capsule. So once observe the picture. So it is the investing layer of deep cervical fascia. So the entire parotid capsule is formed by the investing layer of deep cervical fascia. So this deep cervical fascia at the angle of mandible. This is the angle of mandible and mastoid process. This is the angle of mandible and mastoid process. So at this angle, it is divided into superficial lamina and the deep lamina. It is divided into superficial lamina and the deep lamina. So the superficial lamina is very thick and it is very strong and it is unyielding and adherent to the parotid gland. I repeat, the superficial lamina is thick, strong, unyielding and adherent to the gland, whereas the deep lamina is very thin. So this superficial lamina is attached to the zygomatic arch by forming paratidomasteric fascia. So this superficial lamina is attached to the zygomatic arc by forming the parotidomasteric fascia. Okay. Next. So the deep lamina will be attached to the tympanic plate and the styloid process by forming a stylomandibular joint. I repeat, this deep lamina of the parotid fascia is attached to the tympanic plate. This is the tympanic plate and styloid process by forming stylomandibular ligament. So when you write about the parotid capsule, you should draw this diagram. Okay. Right. So let's recall the things. The parotid capsule. It is a fibrous capsule called parotid capsule. It is formed by the tough investing layer of deep cervical fascia. Earlier we see in this picture. And the superficial lamina is thick, strong, unyielding and adherent to the gland, while the deep lamina is thin. So if you mention these points, it is more than enough. Next, the external features of the parotid gland. So this parotid gland resembles a three-sided pyramidal structure. What is that? It resembles a three-sided pyramidal structure. So with the apex directed downwards. Here in this picture, we cannot see the apex because it is directed downwards. And so the external features of the parotid gland are, it has an apex and four surfaces. What are the surfaces? Superficial surface, anteromedial surface, posteromedial surface. Along with the surface, we have the superior surface also. So this is the superior surface. I repeat, it has four surfaces: superior surface, or it can also be called as base, and superficial surface. One second. So it has the superior surface, superficial surface, anteromedial surface and the posteromedial surface. Next, it has the three borders. What are the borders? Anterior border, medial border and the posterior border. So these are the external features of the parotid gland. Okay. So now we will see the external features in the text form. So it has an apex, it has four surfaces. Those are superior surface or base, superficial surface and anteromedial surface and posteromedial surface. It has three borders. Those are anterior, posterior and the medial border. So pay attention towards here. It is very important. If the parotid gland came as an LAQ, surely everyone has to write the relationship. So I will discuss the relations in a picturized manner. So please pay attention towards here. Okay. So the apex. The apex is related to the retromandibular vein. So here you can see the blue color structure which is known as the retromandibular vein. The apex is related to the retromandibular vein, and you can see one now which is going over there in the apex, that is the facial nerve. So here you can see the facial nerve which is a cervical branch of facial nerve. Okay. So this is the cervical branch of facial nerve. So these two structures are related to the apex of the parotid gland. Right. So next we will look at the superior surface or the base. The superior surface or the base related to the superficial temporal artery which is indicated in the red color, and the superficial temporal vein which is indicated in the blue color. Okay. And it is also related to the auriculotemporal nerve which is indicated in the yellow color. I repeat, the superior surface or the base of the parotid gland is related to the three structures. Those are the red color one, superficial temporal artery; the blue color one, superficial temporal vein; and the yellow color one, auriculotemporal nerve. So these are the superior relations. Okay. Next, superficial surface relations. So superficial surface is related to the skin, superficial fascia and the deep cervical fascia. Okay. It is related to the skin. This space or this structure which I am showing here, it is the skin, superficial fascia and the deep cervical fascia. So these are superficial surfaces related to the parotid gland. Okay. Next, anteromedial relations. What are the anteromedial relations? Those are medial pterygoid muscle. This is the medial pterygoid muscle, and this is the ramus of the mandible, and this is the masseter muscle. So the anteromedial relations of the parotid gland are medial pterygoid, ramus of the mandible, masseter muscle. Just simple is that should remember the whole diagram. If you remember the whole diagram, you can easily write all the relations of the parotid gland. So just draw the diagram and practice for many times. Okay. Next, posterior middle surface. What are the relations of the posterior middle surface? Those are styloid process. So this is the styloid process and posterior belly of digastric. The digastric muscle will have the two bellies, right? One is the anterior belly and one is the posterior belly. So this posterior belly of digastric is the relation here, and this is the mastoid process, and this is the sternocleidomastoid muscle. Okay, I repeat, the posterior medial relations of the parotid gland are styloid process, posterior belly of digastric, mastoid process, and the sternocleidomastoid muscle. Okay. Next, once you observe the picture, this is the facial nerve trunk. So this facial nerve will have the five branches. Those are temporal branch, zygomatic branch, upper buccal branch, lower buccal branch, and the marginal mandibular branch, and the cervical branch. I repeat, the facial nerve trunk will have the five branches. Okay, mainly five branches. Those are temporal branch, zygomatic branch, buccal branch. In the buccal branch, we have upper buccal, lower buccal, marginal mandibular branch, and the cervical branch. So here in the anterior relations, whatever the facial nerve is there, those all four branches mainly are related to the anterior surface. So once you see the picture, right? So temporal branch of facial nerve, zygomatic branch of facial nerve, upper buccal branch of facial nerve, lower buccal branch of facial nerve, and marginal mandibular branch of facial nerve. So earlier in the picture I have shown you. So this all the structure are related to the anterior border of the parotid gland, right? So these all four structures are related to the anterior border of the parotid gland. Those are temporal branch of facial nerve, zygomatic branch of facial nerve, upper buccal branch of facial nerve, and lower buccal branch of facial nerve, and marginal mandibular branch of facial nerve. So along with these nerves, we have one red color structure here, that is the transverse facial artery. Okay, it is the transverse facial artery. So this artery is derived from the superficial temporal artery. So it is a transverse facial artery. And next we have the parotid duct also here. This one, the structure is there now. So this is the parotid duct, and along with we have one accessory parotid gland. Which one? Accessory parotid gland. And next, posterior border. So in the posterior border we have the posterior auricular nerves and vessels. V means vein, blue color one. A means artery, red color one. N means nerve, yellow color one. So these are the posterior auricular nerves and vessels. So these diagrams, whatever the diagrams are there, they should be practiced very well. Then only you can write the relations. My dear friend, the relations are very, very important if the parotid gland asked as LAQ for your final examination. Okay. So right. And next, medial border. The medial border is made by the pharyngeal wall. Just there is a one structure. The medial border is made by the pharyngeal wall. So that's all. So we have discussed all the borders and all the surfaces and the apex. So these are the relations. So I followed the Vishram Singh book, okay, which is the third edition head and neck Vishram Singh book. Once after the completion of the class, you open the book and you can study over there. you can understand very well after seeing this video. So hope you understand, my dear friends. Thank you for giving this opportunity. I would like to request you to share my video. Please drop a like. Please follow my channel, subscribe it, and comment your opinion. Okay, and turn on your notification, because on a weekly basis I will post the videos which is related to the head and neck, upper limb, lower limb, and anatomy entire series of the MBBS first year. So hope you understand, and have a great day, my dear friends. Thank you. This is your Vinay voice.